everybody. Suzanne Paulson, CEO and founder of iEco, and we're back. We are back for the patient educational series, and I'm so excited for this evening. We have an amazing guest with us tonight from our hometown, Southern California, Chino. We're in Temecula, but we may as well be neighbors. An absolutely amazing woman, Dr. Olave Yee, and she is going to share some incredible stories. And before we get to Dr. Yee, we're going to just go through for I think hopefully many of you have been with us with the series. I think we're up to 16 or so. If this is your first time, this is a very interactive, obviously a live event, and we want your feedback and we want to try to help answer any of the questions you have. There is a chat area in the Comcast there. You'll see it where you can just put in your questions. And at the end, after Dr. Yee presents we have three exciting success stories tonight. When we get done, we will take as many questions as we can. And we always promise if we can't get to them, we will follow up with you directly and answer that question. So we're going to try to keep within the half hour, but sometimes we go over, and I have a feeling we might go over about 10 minutes, but I'm really grateful all of you are with us tonight. And I can't wait to introduce Dr. Yee. And first I have to say, Happy National Doctors Day. Yes, today is Happy Doctors Day. And I tell you, we have, it was on that first slide, but what this whole series is about helping dry eye patients connect with great dry eye doctors. And we have a real sense of what that means for us. When we say great dry eye doctors, these are people that are progressive. These are people that are not just giving you drops or something and having you go home and do what you're going to do. They are screening every patient. They are diagnosing in the office. They are doing what they can in office, and first and foremost, putting together a customized treatment plan just for you, providing in-office treatment options, and then sending you home with what we know is a complementary and essential part of any kind of long-lasting relief from dry eye symptoms. So with no further ado, I'd like to introduce you to Dr. Yee, and we are going to go through some of her case studies, 3 of them. But before I get started, Dr. Yee, what brought you into dry eye? Why are you so passionate about helping dry eye patients improve the quality of their life?
Yeah, it's been quite a long journey, but when I went to school, dry eye was mostly artificial tears and maybe warm compresses, but there was not more than just that. It was just that. And when I started practicing, a lot of my patients came to me saying, I have dry eye, I have irritation, discomfort, but I've been using drops for years and it's not working. So it was just that motivation to do more for the patient than just send them home with drops. And just learning about dry eye, the ins and outs, and creating the correct treatment plan for each patient.
I love it. And you mentioned earlier when we were chatting before we went live that you do screen every patient.
Every single patient.
Isn't that best? This is why I have to share. We had this comment as soon as we started promoting tonight. We had one of your patients reach out to us and say, I love this woman. Congratulations, Dr. Yee. Yes, I'm so happy for you and can't wait to watch. You are exceptional. So you have a huge fan base out there, and I'm sure that's with great reason, because there are just millions of people that need your help. So we're I know you'll be amazed at how quickly a half hour goes. So I'm going to keep on moving. At the end, we're going to do some questions and answers.
Yeah, sounds good.
The success story. So we're going to start with your first one here. Oops, sorry. There you go. First one. Good. Why don't you take it away? And I just had rotator cuff surgery, so I'm moving kind of slow doing the slides, but I'm going to do my best not to trip on you.
Of course. Okay. So this patient, I'm starting with kind of a complex patient. This patient is a beautiful, beautiful patient. She's very close to my heart. I've been taking care of her for the past 2.5 years, almost 3 years. And this case is to show patients the complexity of dry eye. It's not something that we just do, overnight and we just snap our fingers and we get treatment. It's dry eye is a chronic progressive disease. So sometimes it takes months, if not years, to really get dry eye into control. So this patient I saw back in 2019, and she's a 50-year-old female. She came into my office for a comprehensive eye examination, and she was complaining of dryness redness, burning, greediness, blurry vision. And these are common signs, symptoms that our dry eye patients come in complaining of. And of course, her symptoms were very bothersome and disrupting to her daily activities. And this was really important to me. Previous doctors told her that she could not see 20/20 due to her high astigmatism. And also she told me that no one really listened to her dryness. Let's talk a little bit about her ocular history. She had a history of vision therapy as a child, and she self-diagnosed her dry eye for several years. And she just self-treated with what other doctors had given her, which was just over-the-counter artificial tears. And she had no medical conditions. And let's talk about her exam. So this is her refraction, it's just her prescription. And when she told me that she could not see 20/20, and she was correct, and her previous doctors were correct that she could not see 20/20, she was seeing 3 lines above the 20/20 line, which, explained her blurry vision that she came in complaining about. But the first thing I'm looking at this prescription is the astigmatism. Other doctors had said that she couldn't see 20/20 because of her astigmatism. And it just didn't seem like there was a reason as of why she couldn't see 20/20. As doctors, we worry about, lazy eyes. We call those amblyogenic factors, which are due to refraction or a prescription. But it was borderline. It just didn't make sense to me. So we dug a little deeper. Her DQ5 questionnaire, she was very symptomatic, 20 out of 22. And when looking at the front surface of the eye, I always say I like to play detective because I'm always looking for any kind of abnormalities. We saw some collarettes and debris on the lashes, and that just means little mites and also bacteria overpopulation. She had some telangiectatic vessels on the eyelids, meaning that there's inflammation present. And then she also had flaccid or lax eyelids, meaning the eyelids were losing elasticity. Whenever I see that during my examination on the back of my mind, I'm thinking sleep apnea. Usually they're linked. Also on the white part of the eye, I was seeing some injection, meaning redness, and also some staining, just meaning an inflammatory response or some damage on the front surface of the eye. Now, the cornea is so important because that really gives us some information as of why vision is blurry. And in this case, this patient had SBK in the very far central and far periphery of the cornea. And I like to explain to my patients, SBK is almost this damage on the front surface of the eye. And it almost looks like someone put tape over the front surface of the eye and ripped it off repeatedly. So definitely
great description of it.
Causing some discomfort. Now, her tear breakup time was decreased. Less than 10 is usually abnormal. And let's talk a little bit about the Meibomian glands. They were capped and blocked. And what those are, they're little oil glands that are lined at the very bottom and top of the eyelid. Ideally, we want them to be producing really clear, beautiful, almost like olive oil in consistency. That way, whenever we blink, that oil gets distributed on the front surface of the eye to give us lubrication. But in this case, with this patient, those glands were capped, meaning that that oil was obstructed and not flowing the way that it should.
Wonderful. Okay. Well, yeah, you're right about the tough case. Great photos here. What are you using for the photos?
Actually, my iPhone. I've become a pro at taking pictures on my iPhone. I'm just a lot faster with it.
That's super.
So with this patient, we diagnosed her with blepharitis and Demodex blepharitis, and also moderate Meibomian gland dysfunction, and of course, dry eye. The bottom left-hand picture, I'm actually doing tear care on this patient, but I just wanted to show this picture because you can really see the loss of elasticity of the eyelids, and that's what we're thinking, possibly sleep apnea. Okay. And the bottom two, or the right two pictures, that's showing that SBK, that damage of the front surface. And these are pictures that I've collected of this patient over the years that I've seen her. And then that's that damage that keeps forming.
And that's all the green spots.
Correct, yeah. And you can kind of see that they're sort of over the pupil, and that's the area where we can see through. So if there's damage through there, of course, it's going to affect our vision. Mm-hmm. So we sent her out for a sleep apnea referral to rule that out, and also Sjogren's syndrome, which she actually came out positive for these two conditions. Mm-hmm. And this is just a picture of the Meibomian glands. So you can see the consistency of that oil. It's very toothpastey, it's thick. And if that oil is very constipated when you're blinking, that oil is not coming out. So definitely important to heat up those oil glands and express the oil so we can get the good oil coming forward to the surface.
Right. Just like any kind of blocked gland.
Exactly.
Gotta free it up.
So for this patient, it's honestly, it's been years of treatment, but I'm just consolidating it into, one slide here, but we did BluffX to clean the eyelids and remove any kind of debris. And then we've done tear care and also eye lugs to express those little capped oil glands. And then we also did punctal plugs once inflammation was controlled. And as we discussed with dry eye, in-office treatments are very important, but also at-home therapies, because it's the homework that you're going to be doing at home to upkeep the results that we've done with in-office therapy. So we put her on just an artificial tear, preservative-free is really important. We put her on Sidra, which is an anti-inflammatory medication, and also the anti-aging foam to be using to use twice a day. Actually, my patient absolutely loves it. She's very happy with it. And we put her on Hydro Eye for just an omega-3 and an anti-inflammatory supplement. And we did tranquil vibes for her. She is one of my most compliant patients. So she's been doing outstanding with her tranquil vibes, and then just upkeeping the results of the tear care and the eye lugs that we've done.
Terrific.
Now, once this patient was diagnosed with sleep apnea, then we had the problem of the CPAP machine kind of blowing air into her eyes, and she was waking up with very severe dry eye in the morning. So we put her on the eye seals, which is pretty much these really flexible goggles that you put over your eyes that you sleep with, and you wet them before using them. So you're creating a moisture chamber while you're sleeping, and then the actual goggles are blocking that air from blowing into your eyes.
I can't sleep without mine.
Mm-hmm.
I have blackout vomits. Not sleep
Me
apnea,
too.
but yeah. That's great. And I noticed you have Hydro Eye and PRN. Was she on two types of supplements?
No, this patient was just on Hydro Eye.
Okay.
She's kind of sensitive to the omega-3s from fish. So we wanted to go with a supplement that didn't have such a high quantity of omega-3s and worked with GLA instead.
Got it. And then we have the nighttime, the Optase.
Yep, we did like a nighttime ointment just to help her along with her goggles, and also the moisture release eyewear. She's very sensitive to changes in temperature, elevation, just from her Sjogren's, and she loves to go on road trips. So she does her moisture release eyewear to protect her from, just increasing humidity.
Super.
While she's
especially here in Southern California, the Santa Ana winds pick up, and going outside is hard on dry eye patients.
Absolutely.
And then some recommended lifestyle changes.
Yeah, so just turning the vents away from your face. If you have air blowing into your eyes, your tear film is going to evaporate a lot faster. And also maybe adding a humidifier to your workspace. Actually, this patient got a car humidifier to help her on her road trips. And also just avoiding arid environments. I know sometimes that's hard. It's maybe the place that we live in, but there's all these things that we can do to help us treat our dry eye and kind of control it.
Yep, good for you. And oh boy, now this is the fun part, huh? The results. Wow.
So no foreign body sensation and irritation. The SPK has completely been resolved, and now she can see 20/20, which is really exciting.
Wow.
Yeah.
Oh, you gave me goosebumps. That's really good. I mean, that's progress.
Yes, which is awesome. And I don't want to say it's all butterflies and rainbows here. Dry eye, like I said, it's chronic and progressive. So there's always, we have to keep at it and do our home treatment. And flare-ups are very common with our dry eye patients. Our severe patients get 4 to 6 flare-ups a year. Our mild patients maybe 1 to 2 flare-ups a year. And that's why it's so important to have a really good relationship with your dry eye doctor, so they can keep taking care of you and making sure those flare-ups aren't too out of control.
That's wonderful. Great advice. Okay.
And,
anything
yeah,
else?
I love the story just because as eye doctors, find a doctor that can really listen to you, that can really help you. And I think it's just a little piece of advice. So dry eye doctors out there, listen to your patients. They're usually telling you what they need. We just got to listen. And also the importance of recognizing underlying medical conditions so they can be addressed and treated. And always offering our patients more than just artificial tears. There's so much more we can do.
That's great. There's so many options now, and it's wonderful. And it all depends on who they are, so it changes from patient to patient, which is now leading to patient number 2. This one we see a lot of here in
Yes.
California too.
So this one is a 46-year-old female patient. She's an accountant, meaning that she's spending so many hours on the computer. She came in for a comprehensive eye exam as well, and she was complaining of dryness, irritation, and eye pain. But her main problem was that she couldn't really withstand her dryness when she was in the computer. So with prolonged computer use, and also that her dryness worsened when she was driving with the AC and the fan. And she also told me that she got lash extensions because her lashes were very, very brittle and very small. And ocular history, she did have strabismus on her left eye, and then she had decreased vision on her left eye due to amblyopia. And she was getting eyelash extensions on a monthly basis. So in terms of our diagnostic tools, her DEQ5 also very symptomatic like our previous patient, 20 out of 22. When looking at her eyelashes and her eyelids, she had her lash extensions, but also 3+ collarettes of those little mites in the lashes. She had some redness in the white part of the eye, and also some damage on the white part of the eye. In the cornea, again, some damage at the very bottom part of the eye, which is kind of different from the presentation of the previous patient. And usually the location of the SPK or the damage can also tell us what is causing that dryness or that damage. This patient also had blocked oil glands and also very low tear breakup time, a lot worse than our previous patient. And her lacrimal tear height was also moderate. We diagnosed her with dry eye, Demodex blepharitis, and moderate Meibomian gland dysfunction.
Okay, boy, oh, more photos. Wow.
I love to show this picture because it tells us so many things. Let's take a look at the very bottom part. You can see the eyelid, but right on top of the eyelid, you can see that black area there. And what that tells us is that the tear film is evaporating there a little bit faster than the rest of the eye. And the reason is eyelash extensions. Whenever we have the lash extensions, they're very long and they're very heavy. So I feel like in my clinical experience, our eyelids become almost lazy, they don't want to fully. So we're almost getting like partial blinks like this.
Interesting. Okay.
And then we're getting that irritation and that dryness at the very bottom part of the eye, but also the long lashes also create a change in aerodynamics. So we're also fanning our eyes with those lash extensions because they're so incredibly long. They're beautiful, but they're also very long.
I've heard that referenced as like a wind tunnel effect.
Absolutely.
You have the lash extensions.
Mm-hmm.
Oh boy.
Mm-hmm. I love this picture because this is my patient. You can see on her eyelids, you can see that redness from her blepharitis. And then this patient had just recently got an eyelash fill, I think a couple days before coming in to see me, but you can actually see the eyelid, the collarettes, which all the mites are concentrated, and then the lash extension is placed. And on the right-hand side, you can see her expression when we did tear care. You can see, again, the little oil glands are very constipated. They're very toothpastey in consistency. So definitely something that we needed to improve on.
Wow. You think they put those on without cleaning those? Different question. I just don't, I mean, would it happen that fast that it would create like it had anyway? Okay.
I would guess that these patients already had
before they put the lash extension on. Yeah,
absolutely. And then just the lash extensions makes it hard to clean, so even harder. Yeah. So after I showed my patient those pictures, she wanted them out. So on the same day, we got the lash extensions out, and we actually used the Aiko anti-aging foam. It has that oil component from the tea tree, so it actually dissolves the glue from the lashes. So we did a few washes with that in office, and then we actually used Bluffex to remove the Demodex fully. And we also I did lacrimal irrigation on this patient. Whenever I have a patient with a lot of inflammation and also Demodex mites, I like to flush out the lacrimal system to make sure everything's completely out of the eyes. And we also did tear care on a different day for this patient.
Okay, great.
And in home therapies, just an artificial tear, we did Optase, an oil-based artificial tear with no preservatives. We did the anti-aging foam for maintenance after we do. I've noticed that once I do Bluffex and I clean the lashes, when I have my patients come back for like a 2-week follow-up, I see sometimes even more mites come out. And it's just, we're going through the process of such a recalcitrant condition that we have to continue treating it. but a cleanser at home is a great way to keep things under control. Since we did see the toothpastey expression from the oil glands, I put her on PRN, which is just an omega-3 medical grade, and really important to have the right concentration of omega-3s. Over-the-counter omega-3s don't always have the concentrations to give therapeutic dry eye help. So definitely something important. And then for maintenance of her on her tear care, we did the Tranquilize XL, and we were doing that once a week for maintenance.
Terrific.
And then lifestyle changes, really important to discontinue the lash extensions, and also really important to do visual hygiene. So the 20-20-20 rule, I don't know if your previous doctors have talked to you about that, but it's just look every 20 minutes, look 20 feet away for about 20 seconds. And I add in blinking exercises. And this is our chance to really get a really good blink. Whenever we blink, we have little muscles in our eyelids that express that oil in our eyelids, and that creates little micro droplets of oil to lubricate the front surface of the eye, especially when we're spending so much time on the computer. I'm guessing right now I'm not even blinking that often, but
yeah, you have to remind yourself. That's a great rule. I love it. 20-20-20, easy to remember. Every 20 minutes.
Look 20 feet away, which is just technically infinity, and then just do a few
20
blinks.
seconds. That's great. That's wonderful. And patient is happy. We love seeing that.
So the reason why she got the lash extensions in the first place was because she was saying that her lashes were very small and brittle. Whenever we have Demodex blepharitis, the lashes tend to fall out. Also, Demodex, they cause lash misdirection, or they fall a little bit more prematurely. So they're not allowed to complete their full lash cycle. So we're actually taking care of the little mites. Now the lashes have the opportunity to fully grow to their full cycle, and they'll just appear longer and more thick. So she's seeing her natural lashes coming back. So she's really happy about that, and no irritation or eye discomfort. And now her dryness is controlled on the computer, and then she's able to do her work.
Wonderful, wonderful.
And I love this story just because, educating patients on lash extensions and also having a good doctor and patient communication. I know sometimes when it's hard to get patients out of their lash extensions because they love them so much, and just having a patient that is, willing to take care of her eye health first and being compliant with her home treatment.
That's great. That's a wonderful story. Oh boy. Okay, number 3.
Okay, perfect. So this patient, I love this case because it's a 62-year-old male. He's self-employed, but he came in because his primary care doctor asked him to come in for a diabetic retinal evaluation. He did have diabetes. And he told me that he didn't need glasses. He was using over-the-counter readers. He didn't really want to be there. Let's put it that way. He told me he had some mild irritation on his eyes, some itchiness. It's been there for a long time. It doesn't bother him. If the itchiness he has is just because he has seasonal allergies and not bothersome at all. So he has seasonal allergies and also diabetes. So I did a screener anyway on him. His DQ5, you can see, is very low. He's very asymptomatic, just 3 out of 22. Now, looking at the anterior segment or the front surface of the eye, he had 4+ cylindrical collarettes around the base of the lashes, and his lashes were very misdirected. As I mentioned, whenever there's little mites, the lashes aren't allowed to grow the way that they should, and they're just misdirected. He had some telangiectatic vessels, meaning that there's some inflammation going on, and then 2+ saponification. Whenever I see that, it almost looks like frothing in the outer corners of the eyes. And whenever that's happening, it's because the normal bacteria of the lashes is actually, or the eyelids, is actually overproducing, and it's causing a chemical reaction with the front surface of the eye. And we get this frothing sign. He also had.
Sorry, could you say that again?
Siri's
chiming in. Dry eye.
She's chiming in. She's got dry eye. She wants you to diagnose her.
And then on the front surface of the eye, definitely some redness and also some staining from the inflammation. He also had some capped glands, and they're also blocked. And also very decreased tear breakup time, or his tear film was very unstable. And also had some damage on the cornea on the very bottom part of the eye, very similar to our previous patient.
Okay, boy, more great photos.
So this is our patient. So he was actually diagnosed with ocular rosacea, and ocular rosacea is almost like a syndrome, and it's composed of dry eye, but it's like a subset of ocular rosacea, and we have to treat each individual diagnosis individually as well. So he had ocular rosacea, but also severe Demodex blepharitis and dry eye, and then moderate Meibomian gland dysfunction. And you can see here all those little blood vessels, the telangiectatic vessels on the base of the eyelid. And you can also see the collarettes. They've been there for what I can only imagine at least 5 years, if not longer. And you can see the misdirection of the lashes. They're not growing the way that they should. They're almost shifted to the sides.
Yeah, they're redirecting traffic in the wrong direction. They are. That tells that those are great pictures. They really tell the story. They really do.
Absolutely, yeah.
Like an icicle.
So we did BluffX on him to remove those little collarettes, and you can see the before and after. And even after one treatment, you can almost see that the lashes are kind of creating a more normal, they're having a more normal curvature. And the inflammation is still there, but that's part of rosacea. And then that comes with the next treatments that we'll do for him. Okay. So in office, we did BluffX. He's very ticklish with BluffX. So sometimes we do a back and forth of Cest or BluffX, depending on how bad the little mites are. We did tear care and lacrimal irrigation as well. Now at home therapy for this patient, it's so important. We did artificial tears, we did Restasis to control the inflammation, and then we put him on the advanced cleanser because he had very recalcitrant Demodex. At first, we were doing, I think, BluffX cleanings on him every month, and they would just come back so aggressively. And it just means that he had been so, he was undiagnosed for such a long time and didn't have any treatment. We also put him on Avenova, which is a different type of cleanser that targets a different mechanism of action. And we put him on Neolids, which is almost like a little toothbrush. It's to clean the lashes at home. We also put him on an omega-3 medical grade as well. And then we put him on the Tranquilize to upkeep the results of tear care once we expressed his oil glands. And now with ocular rosacea, it gets a little tricky because we have an inflammatory response. And if we do warm compresses, yes, we're treating the obstructive component of their rosacea, aka their Meibomian gland dysfunction, but also sometimes our rosacea patients can get triggered by using too much heat. So we had to go back and forth with cold compresses and warm compresses. So that's why I put as tolerant for the Tranquilize. And I also put him on a low dose doxycycline to control his rosacea, but I can't keep him on that forever. And I also did refer him to dermatology. Sometimes dermatologists can treat other parts of rosacea with azelaic acid and other topicals.
Got it.
Yeah, and then just little changes to their lifestyle, just avoiding environmental triggers. Usually we have to find out what is triggering their ocular rosacea. Usually it's alcohol and
chocolate.
I know, chocolate in hot weather, yeah. And this patient loves to drink beer, so I told them just cut down, and at least they know that if they have some beer, then
okay, once a week.
Yes.
Okay, that's great.
So great things about him, even though he didn't come in complaining about dry eye, he noticed that, light doesn't bother him anymore when he's outdoors and his eyes don't water. And
right.
also the eyes are way less red, and his wife notices, which is a great compliment. Yeah, that's awesome. And now he realizes that the itchiness, it wasn't really allergies. There was something else going on, right?
Yep.
And then I think I love the story just because this is the importance of coming in for comprehensive eye examinations. Even if your vision is good, we love to do eye exams to take a look at the health. And then that's the entire eyeball in its entirety from the front to back to make sure that everything is good. And also the importance of doing dry eye screeners. Even if the patients are asymptomatic, a lot of our dry eye patients are asymptomatic. And then just consistency of doing good home dry eye treatment.
That's wonderful. And that really, you right at the beginning when it was what, 3, the DQ5 score was 3, only 3. I mean, and you see what percentage of your patients do you think are asymptomatic?
Oh my gosh. I would say maybe 60%.
Wow. Isn't that something? So that's why you need to find great dry eye doctors. Dr. Yee. Okay, let's see what kind of questions we have from the audience here. And the while we're doing it, the other thing that I've noticed that every single one of these was customized again. And there are different tools in your toolbox that you use, and it's an ongoing process. And I think that's one of the things that we've seen over and over again, that people really, if you have friends and colleagues that have dry eye and they've been given one kind of a protocol, it doesn't mean it's the same thing that's going to be working for you. And that's why it's
Right.
really important to sit down and talk to everybody. A question here was, when you're doing the tear care iLux, is there a difference when you're doing, like, why you would choose one over the other?
Yeah, so it kind of depends on the patient, but usually tear care is my go-to as the initial treatment, especially if there's a lot of blockage. I feel like I can get a really good expression with tear care. And then with iLux, it's just a different mechanism of action. And I think it varies on the presentation, to be honest. And then these are things that we can also discuss when we have, a dry eye evaluation.
Great, that's super. Here's one: my lids, especially lower lids, pull away from my eyeball. Can I do anything to help them and strengthen them? I have a lot of inflammation and severe dry eye and cannot use regular eye drops due to bad reactions. I use optimal Manuka drops.
Okay. So just because there's the loss of elasticity, there's probably some underlying component going on. So I would say go find your dry eye doctor that can help control that inflammation, so we can help improve the elasticity of the eyelids. Sometimes there are also age-related changes. So it might have to be like a triad communication with an oculoplastic surgeon, dermatology, but definitely starting with a comprehensive eye examination would be a really good start.
Okay, great. Let's see. Ian asks, can Dr. Yee reshare when she recommends PRN and when she might recommend hydro eye?
Yeah, so it depends on the mechanism of action that you want to take. So omega-3, so the reason why we did hydro eye for my first patient, it was just because she was very sensitive to omega-3s, like fish oil omega-3s. And with hydro eye, the amount of omega-3s is mostly a carrier. It's not the primary component. It actually has GLA, which is an anti-inflammatory. But if you're able to tolerate omega-3s and fish oil omega-3s, I would definitely go with PRN. It is probably one of actually the only omega-3 that has that concentration of 3:1. We want a high concentration of EPA, the ratio of 3:1 of DHA in order to get improvement with dry eye symptoms.
Awesome, great answer.
Mm-hmm.
Let's see, great question. How often do you recommend to get dry eye exams done?
That's a good question. So I would say comprehensive eye examinations should be on a yearly basis, because things change very rapidly with dry eye. But when I'm seeing my dry eye patients, I don't let them go for an entire year. I'm actually seeing them on a 3-month or 6-month basis, sometimes sooner, until we get really good control. But for sure, comprehensive eye exams every year, and then probably follow-ups very short after.
Yeah, I would think it really would depend on their condition, right? What's triggering it. Let's see, are sclera lenses a good remedy for MGD?
Scleral lenses, not necessarily for MGD. Scleral lenses are a great treatment for dry eye, so definitely a good option, but definitely not for MGD. MGD is a completely different mechanism of action that we have to treat. MGD is treated more with, tear care, iLux, LipiFlow or Meiboflow, and scleral lenses is more to give more moisture on the front surface of the eye and prevent any kind of damage, but very different mechanisms of actions. I would recommend talking to an eye doctor about that.
Okay, very good. And then let's see, do you recommend CEQA?
CEQA, yeah, absolutely. Depending on your diagnosis and what is going on the front surface of the eye.
Okay. Another one here. We'll take this. This will be our last one. I know we're 5 minutes over. We're doing good. Thank you for staying on with us.
Of course.
You're amazing. Doctor, can you please share the importance of the combination of eyelid hygiene, in-office treatments, and at-home treatments? Meaning, if I don't do my at-home therapy or skip my omegas, can I still get better, or will I continue to get worse? That's a big question.
Okay. So
I know how I'd answer that.
I hope I understood correctly, but it's a combination of both. So I think it was, if I do office treatment, do I still need to do home therapy, correct?
Yeah, basically, if I don't do my at-home therapy or skip my omegas, I'm basically non-compliant, right? Like I go in and I see you and I get the tear care done, I get the ILEX done. I'm walking out the door with my goodie bag that I've taken for my home therapy, and I just think I'm just too tired at the end of the day. I'm not going to do it.
I get you. And I have some patients like that as well that I'm taking care of. So, I mean, yes, you can, but in terms of results, they're not going to be as good.
Yeah.
Let's say that you come in to see me for an eyelid cleaning, and yeah, results may last about 3 months, maybe a month, depending on your severity. But if you're not upkeeping it, then we're not going to get really good results. So think about it this way. You see your dentist for cleanings every 6 months, right? Sometimes even 3 months. But at home, you're still doing your homework, right? You're brushing your teeth, you're flossing, and you're doing mouthwash. But if you're not doing those 3, then what's going to happen? We're going to get more plaque buildup. We're going to get, bad breath, even cavities from forming. So same concept. We have to do both.
Excellent.
Yeah.
Dr. Yee, I am so excited. Again, we're gonna where you are located is Acute Vision Optometry in Chino, California. We're putting her contact information up here. It has been an absolute pleasure spending this time with you. You are remarkable. And anybody who is in the Southern California area, or somebody in the Southern California area that is looking for a great dry eye doctor, please reach out to Dr. Yee. You're exceptional, and we thank you for everything you're doing for dry eye patients.
Thank you so much for having me. Thank you.
My pleasure. Good night, everybody. We're going to have more of these. We can't wait. Stay tuned. And we're just getting started for 2022. Have a wonderful evening.
Bye, everyone.